So physiological testing is the use of scientific instrumentation to be able to measure your physiological baselines. To make that a little bit easier, what we can do is we can measure your three systems in your physiology that we can measure, which are cardiovascular, so your heart and your vessels and your blood, as well as your respiratory system, so your lungs and your ability to be able to deliver oxygen to the muscles themselves. And then of course the metabolic, which is at the cellular level, so that your cell's ability to be able to use oxygen and fuel to be able to create energy. And the importance of these baselines is that we can then determine how each of those components of your physiology are at this particular point and what you need to focus on to be able to improve them for the future. So metabolic testing is the use of a device that could actually measure oxygen and carbon dioxide. There's a lot of devices out there that don't have the ability to measure both, but it's extremely important that if you are going to be tested, that the device that they use measures both O2 and CO2, or oxygen and carbon dioxide. The reason why this is important is by looking at the contrast between the oxygen you use and the CO2 that you produce is the gold standard measure of how much fat and carbohydrates you burn, and therefore the total calories that you burn during exercise at different intensities. This is extremely important to not only to let's say an athlete who is trying to plan their nutrition for a race, but also it measures your ability to use fat and carbohydrate, how you use them, when you use them. For those people all the way through medical clients, let's say somebody with a metabolic condition like diabetes, they have a tendency that they will use carbohydrate really early and not use fat. Well, we can actually measure this by having the O2 and the CO2 components that's available through metabolic testing. Traditionally, you think of metabolic testing as you see an athlete with a mask running like crazy on a treadmill, and all the gases are being collected. Essentially, it's the same device, but highly applicable to all different populations, including medical, general population, as well as athletes. So physiological testing can work with many different populations. There's a tendency to believe that, traditionally this has been mainly used with high-level athletes. But physiological testing, including metabolic analysis, spirometry, where we measure your lung volumes, near-infrared spectroscopy, where we measure your cell's ability to be able to utilize oxygen that's being delivered. All these components of physiological testing will tell us a lot about the baselines of each person. So in the case of a medical patient, they could be recovering from a cardiovascular incident, or they could have a respiratory condition like chronic obstructive pulmonary disease or asthma, or in the case of a metabolic disorder like diabetes or obesity or metabolic syndrome. All of these things can be measured and determine your baselines for the medical population. For the general population, it's really important so they can actually focus their training to best maximize their time. I mean, an elite athlete has hours and hours and hours of time to be able to train. Whereas in the general population, if you are training for a half marathon or a 10K race, you only have a set period of time that's available to you. You don't want to waste any of that time. So metabolic analysis allows me to be able to measure your baselines, set your intensities, and identify your limitations, and be able to therefore prescribe the right exercise and or nutrition to be able to maximize your time. For the elite athlete, obviously every percentage of improvement is extremely important, and you are generally trying to hit everything. What physiological testing will tell you is specifically what your limitation is and how to maximize your performance. So medical, improve your health. For general population, improve your performance, function, longevity. For the elite athlete, to improve your performance. If we look at who would benefit from physiological testing, we could really divide them into three different camps. You have a medical population, you have the general population, and you have the athletic population. For the medical population, they are already working with a physiology that has been hampered or altered in some way due to their condition. So that ability to be able to do physiological testing and identify how their disease or their condition has affected their physiology, we can see that live. We therefore can then design programming and nutrition programs based upon those results to maximize the effectiveness of the training program or nutrition program itself. Remember, their physiology would be different, so therefore you cannot go online and find a program that would be applicable to, let's say, somebody who has diabetes. Their nutrition system, their energy system will work completely differently because they have that condition. For somebody with a respiratory condition, if you don't focus the training on reestablishing normal respiratory capabilities, you're not going to see the improvement. General population, they'll benefit by being able to identify intensity zones, so accurate zoning, which is the intensity at which you're working out, to be able to determine how many times per week they need to be able to work out to be able to achieve their goals. And they'll also get a measurement of their longevity, the likelihood of them living a long life. And we can also possibly find some baseline disease issues, like a medical issue, long before it actually gets diagnosed. And for the athletic population, it's about improving performance. So we can identify what your performance limitations are and be able to design a program specific to improve your performance and get you on the podium. VO2 Max is a measure that a lot of people have heard about, but they don't necessarily know exactly what it means. And it's becoming more and more popular in the media right now. So VO2 Max just simply means the max amount of oxygen that you can use during exercise. So what we do is part of our graded exercise test, we'll provide you with your VO2 peak or your VO2 max. And what that does is represent kind of a representation of your cardiorespiratory system. And what's nice is there's a set of norms that's available that's gender-based, age-based, that we can compare your results against in order to determine where you sit between poor and superior or elite. This gives you a very clear idea where you sit in comparison to others, your age and gender, but not only that, it is the gold standard measure of longevity. So that's the likelihood that you are going to remain healthy for a longer period of time. So out there now, you're going to see all kinds of articles on VO2 max and the importance of having a good VO2 max. So one of the tests that we do here is a resting metabolic rate test. And you're going to see lots of references to RMR or BMR, basal metabolic rate. And it represents the amount of calories you burn just to exist, which means breathing, your heart, digestion, etc. Just physiologically to keep your body running. And an RMR is the gold standard measure of the calories that you burn in a day. Why this is important is other people try and guess, and there's lots of algorithms out there that's based upon height and gender and weight. And there's also calculations based upon if you stand on a scale, they'll give you what your estimated BMR or RMR is. And they're inaccurate. Everybody's trying to be able to give you the gold standard answer, and the only way to do that is using metabolic analysis. And by doing an RMR, you can find out where you sit specifically against others, your age, gender, and height, but also on top of that, you can find out what percentage of fat and carbohydrate that you burn at rest, which gives us an idea of your metabolic health. And you'll have a very clear idea of the exact number of calories you require. When that comes to being important is related to weight gain or weight loss. So no more guessing. With an RMR, you can actually have the number of calories you require to take in and therefore be able to set your nutrition plan much more accurately. So your resting metabolic rate, or your RMR, is extremely important, whether you're a medical patient, a general population, or an elite athlete. So if we can measure the exact number of calories that you burn during a day, then we can properly set your nutrition plans. If we take the number of calories you burn and compare to other people, your gender, height, and weight, we can also determine whether your metabolism is fast, normal, or slow. This is really important when it comes to deciding the importance of, let's say, resistance training in your programming if you want to lose weight. If you have a fast metabolic rate, the likelihood of doing resistance training to improve your metabolic rate and burn more calories is low. You're best spending your time doing something else. In the case of the general population, again, you need to know that number to be able to make any kind of adjustments to your nutrition to be successful with any weight loss or weight gain that you wish, but also knowing what percentage of fat versus carbohydrate that you burn will tell you give you an idea of how healthy your metabolic system is. You should be able to burn about 70% fat and 30% carbohydrate when you're at rest. We measure this by using carbon dioxide and O2 sensors to be able to measure your breathing, to be able to determine what percentage of fat versus carbohydrate you burn. And that allows us to be able to know whether your metabolic system is something that needs to be prioritized. For the athlete, again, setting nutrition goals is extremely important, and it's a resting test, but it gives us an idea of how many calories are required to be able to maintain, lose, or gain weight in the athletic population as well. Now, using near-infrared spectroscopy, using metabolic analysis and spirometry, I can clearly identify any of three systems' limitations. Cardiovascular, so your heart and your blood vessels in your blood. Respiratory, lungs and their capacity to deliver oxygen to the muscles. And metabolic, or cellular, your cell's ability to use oxygen and fuel to be able to create energy. So I can measure any one of those systems and be able to determine if any of them are a major limiter or moderate limiter. And then what I can do is work with you to be able to devise a training program at the appropriate intensities to be able to maximize your goals, whether it be from a medical condition that you want to become more healthy, whether it's a general population you want to lose weight, or you want to improve your function or longevity, or whether it's an elite athlete wanting to be able to improve their performance. Right now there's a lot of stuff on the web about respiratory training, and I've been doing respiratory training with my clients for over 20 years, using multiple different devices and different systems. And I can say that I am absolutely certain that you can actually improve respiratory limitations, but your goal should be to identify those with respiratory limitations that require the training, and not just give it to everybody. So one of the great things about physiological testing through our system is we use spirometry, and that's to measure your lung capacity and your ability to use it. And then during your active tests, we actually measure the volume you're capable of breathing per breath and the frequency of your breathing, and be able to put that up against your spirometry to be able to determine whether you have a respiratory limitation at all. If you do, which is somewhere around 20% of the population that I work with, you can retrain them. Whether they're a capacity limitation, meaning that their lung volumes are decreased, or their power has decreased, or whether it's their ability to use their capacity when they're moving. And if we can identify the difference between the capacity limitation and the capability limitation, then I can train them. But it's really important to note that training needs to be specific to the respiratory limitation, not the diagnosis, the actual result that we see through spirometry and through metabolic analysis. A lot of people believe that physiological testing in its traditional sense, you know, the mask and the guy just working as hard as he can on a treadmill is physiological testing. And it is, in the sense that it has been used with elite athletes for years. But it's not just for elite athletes. In fact, it's for all populations. And medical populations would benefit by having a really good set of baselines of where they're sitting, and therefore we can assist them with their nutrition and their exercise prescription and make it more refined specifically to them. General population, they're short of time, they only have so much time to train, and if they have a race coming up like a half marathon or a marathon or a 10K, or they're a cyclist, everybody wants to get better and make sure they're doing the right type of training with the limited time they have to train. So this is what physiological testing in a general population, I can help the weekend warrior become more effective and more efficient in their sport, but also longevity becomes really important in the general population. So that's your likelihood of being able to live longer and longer, so that getting the baseline measure of the general population will help with the determination of how likely they are to live long. The other thing with general population is there's usually a desire to lose some weight. So to set nutrition programs, doing physiological testing will provide you with the exact information that you need to be able to be successful with your exercise and your nutrition plan. Yes, it's for the elite athlete who are seeking, a 1 to 3% improvement, and they need testing to be able to determine what system needs to be worked on the most to be able to have the largest effect on race day. And yes, it provides that information for that population as well. But I would say I'd much prefer to see physiological testing used, the medical and general population, to keep them healthy and get them to be able to live long and healthy lives. One of the best uses of physiological testing are for those that want to lose weight and or lose fat. You need accurate idea of what your resting metabolic rate is. In other words, the calories that you burn just to survive during a day. You need to know how you compare with others, your age and gender and height. And you also need to know how your metabolic systems are working as far as how well you burn fat versus carbohydrate. This is why physiological testing is really good for people who want to lose weight, whether it's someone who's over in the medical side with obesity and diabetes or within the general population. Having that baseline information allows us to be able to determine exactly what nutrition plan you need to go on, at what calories, but also helps us to be able to define the exercise prescription. In other words, how important is resistance training specifically to you in your weight loss goals versus doing cardio or higher intensity work? And what are the intensity levels or zones that you need to work on to be able to burn the most amount of calories or the highest percentage of fat? Physiological testing provides that information to anyone that wishes to lose or gain weight in the best way possible. It is a gold standard for being able to determine how much fat and carbohydrate and calories you burn. So if we look at nutritional goals specific to physiological testing, the resting metabolic rate, again, it gives you the amount of calories that you burn per day, of which you can do a comparative against norms to determine whether your metabolism is slow, normal, or fast, as well as your metabolic health on what percentage of fat versus carbohydrate you burn at rest. But it also allows us to be able to set nutritional goals for you with the active test. In other words, we can determine how many calories you're burning per hour or per minute during different intensities of the exercise test. Not only that, we can tell what percentage of fat versus carbohydrate that you're burning at different intensities. And with that information, we can design absolutely anything for our clients. We can set a good baseline nutrition plan, Plus, we can determine if we give them an exercise program, how many calories they're going to burn accurately, not like an app, not like one of the watches who does it through algorithms, but actually have measuring your gases being exchanged. We can accurately determine how many calories you burn per hour and what percentage of fat versus carbohydrate you burn. So that information for the weight loss group, extremely important, but also for the elite athlete who is doing training plans and wants to know how many calories they need to take in and what percentage carb versus fat they need to take in during a race. All that information is there available from the active test. I'm firmly of the camp that the first device that you need to own is a metabolic analyzer with oxygen and carbon dioxide. If you don't have both gases being measured, you can't measure calories, you can't measure nutrition. You also can't get a bunch of other metrics that are extremely important to analyze your physiology. So I always start with a metabolic analyzer, high quality. The second is near-infrared spectroscopy, which is a small device that we actually can place directly on the muscle that's active during the activity that we're testing you on. And it measures the percentage of oxygen on the hemoglobin. And what that does is it tells us how well you're delivering oxygen to the cell. It also tells us how well you're using the oxygen that's being delivered at the cell. It's the best method of looking at metabolic health directly at the muscle. The other device I use is a spirometer. I need to measure your lung volumes to determine whether you have a limitation during your tests. And without your particular lung volumes, how do I know? So I combine those three devices, spirometry, metabolic analysis, and near-infrared spectroscopy to give me the most clear review of all three systems that I wish to cover, which is cardiovascular, respiratory, and metabolic. The process, we test you on the device that you plan on training, and that's extremely important. If you're a walker or a runner, we use a treadmill. If you're a cyclist, we use your bike or we use a cycle ergonomer. If you prefer to row, we can test you on rowers. So it's really important because your performance is based specifically on the device or modality that you use to train. We do a resting test, we do an active test, and then we do a thorough analysis of all the results, and we spend 30 minutes with you afterwards to be able to explain your results, your limitations, and then we devise your nutrition and exercise programming to be able to make sure that you achieve your goals effectively and efficiently. I've worked with a variety of companies over the years, and of course I'm not going to mention them all, but currently I use the Core Cardio Coach Pro, and I choose to use that because it's reliable, it's extremely accurate and robust. It measures oxygen and carbon dioxide, and that's really important because if you're going to get tested by other companies, make sure that their analyzer measures both oxygen and carbon dioxide. If not, you're not getting a clear idea of your physiology because without those two gases being measured simultaneously, you can't measure things like nutrition or how many calories you're burning and what percentage of fat versus carbohydrate you're burning. So my first device, metabolic analyzer, Core Cardio Coach Pro. I work with two near-infrared spectroscopy devices. One is a Moxie and the other is a NOx device. And both of those measure directly at the muscle in question your oxygen delivery and utilization at the cell. And then for spirometry, I use a mirror spirometer, highly accurate, highly effective, and good software that gives me an analysis of the person's breathing at rest, and then I can apply those scores against how they perform during activity as well. So that's the equipment that I choose to use. The combination of equipment that I chose to use tells me everything I need to know to be able to determine limitations by system, cardiovascular, respiratory, and metabolic. It tells me everything I need to know about their nutrition requirements for me to make recommendations specific to their nutrition. It tells me everything about their general physiological health at rest and during activity. It allows me to be able to do analysis to accurately set intensity zones. Probably the most important part of training is to determine what zones that you actually change different fuel sources. And then the best way, the most accurate way of doing that is through metabolic analysis itself. So I get limitations, I get zones, I can prioritize what type of training is more important. Is it resistance training? Is it zone 2 cardiovascular training? Is it higher intensity training in order to be able to maximize your VO2 max or your recovery or your metabolic health? So it tells me every piece of information I feel I need to know to be able to clearly design a program that's individualized for that specific person. So once you've identified these systemic limitations, again, cardiovascular, metabolic, or respiratory, can you train them? And the answer is absolutely. And that's what's delightful about this. It's not just a test where somebody hands you a piece of paper and say, congratulations, your VO2 max is 52.8. That's relatively useless information. What we do is we be able to identify primary, secondary, tertiary limitations, and then we design your specific training program to be able to address those. If it's a respiratory limitation, we can include respiratory training. And what I use is the Breathe Way Better device from Isocapnic, which is a bag and a valve, and we're able to actually measure your volumes and your frequencies to be able to retrain your respiratory system in conjunction usually with manual therapy or manipulation and exercise prescription if you have any limitation to the thoracic spine or ribs. So that's specific to respiratory. We can also train you on coordination, using your respiratory system better during activity. Cardiovascular, we can adjust your training intensities to be able to have the best response to improve your cardiovascular health. And metabolically, the same thing. We can adjust intensities or nutrition to be able to improve your metabolic system's health over time. So there are different options for testing, but I would strongly recommend that we need to do your resting metabolic rate and your active test, your VO2 max test, and your spirometry. Now, again, which device we choose to do it on should be related to the activity that you're doing or that you're training for. In the case, for example, of fighters or martial arts, we can use things like an aerodyne bike or an assault bike that involves both upper and lower extremity, or we can work on walkers, for example, or fell runners, where it's based upon a combination of speed and elevation. So we can use all of our modalities and be able to adjust them to make them most specific to the activities they're doing. In the case of triathletes, it's tough because you're doing 3 different sports, and what we find is your limitations and your zones and your prioritization. Cycling may and quite probably are completely different than those for running. So we do offer some options for our triathletes to be able to do multiple tests on both devices, both treadmill as well as on their bike. And I think that's really important, is to be able to do the testing in each modality, but to do more than one test, because without that, all we have is baseline. We don't know how you've changed over time, and I'm expecting large changes. So that we do offer a savings if you book more than one test, because I feel it's really important for you to be able to see the changes in your physiology over time with the new training programs given. I'm a strong proponent of people not booking just one physiological test, because that's just a snapshot in time. And I expect large changes in your physiology with the training and the nutrition that I prescribe. So therefore, I recommend at least 2 tests, if not 3 tests over a year. Now, normally this is your baseline test. Usually 8 to 12 weeks later, there's significant changes in your prioritization of what your limitation is, as well as your zones may change, so your intensity zones may change by as much as 15 to 20 beats. Therefore, your entire program needs to be redesigned and those new intensity zones need to be applied. After that, I recommend about 6 months after that. So you're looking at ideally 3 tests per year would be ideal depending on which population you're in. The elite athlete may want to do more or less, but for the medical and the general population, and even the elite, I recommend 3 tests per year. First one after 8 to 12 weeks, second retest after about 6 months. So physiological testing is safe for everyone, or we've designed a system that makes sure we capture those who are potentially unsafe. So before you're allowed to test, you have to complete a form called a PAR-Med-X. That needs to be reviewed by me. I'm a registered clinical exercise physiologist, and I can determine whether you're safe or not to test. If you come to me, let's say post-cardiovascular event, and any limitation has been set by your cardiologist or your general practitioner, then a discussion will happen to make sure that you are safe. In addition to that, on the day of the test, we make sure that we do baseline measures to be able to ensure that you're safe on that day. Blood pressure, ECG, pulse oximetry, and we go through your questionnaire and make sure that we clear you prior to the testing on that day. The resting is obviously very safe as you're not really doing anything for a 20-minute period. The active test is defined by your abilities, which means that even though it may be a maximal or submaximal test, that maximum is actually selected by doing what we refer to as a parameter check to make sure the parameters of the test are within your capabilities. And of course, you can quit at any time. We monitor you for any kind of dizziness or feelings of instability or confusion, and we make decisions at that point to be able to end the test. In 25 years of testing, I've never had a single issue with any of my clients completing their testing. Essentially, training zones are trying to identify certain levels of intensity which that you get different training responses. But they're all trying to find, essentially, where you change intensities based upon changes in fuel. So in other words, in zone 1, you're mainly burning fat. In zone 2, you're burning a high percentage of fat with a small percentage of carbohydrate. By the time you're in zone 5, you are now just burning carbohydrate and also creatine phosphate. Not important that you understand the fact what creatine phosphate is. What's important is each of these zones is supposed to represent where you're changing fuel sources, all based upon rate of energy production. So as you ask more for your body needs to create energy at a faster and faster rate. Certain systems within our physiology are only capable of delivering energy at a certain rate. So we see a change in your body, being able to breathe faster, for example, obviously heart rate. In the cases of things like lactate, they look for a large increase in lactate production. We can look at near-infrared spectroscopy and be able to see a massive decrease in the available oxygen that's available. There's multiple different ways of measuring it. I believe in using multiple devices because it best allows me to be able to determine when you're changing fuel sources. And I go back to my points previously. Without O2 and CO2 measurement, you cannot measure what percentage of fat and carbohydrate you're burning. So with metabolic analysis is the best way to be able to determine your intensity zones. And since your intensity zones are the key to you making performance improvements or health improvements, metabolic analysis is the best way to get your training zones. And with the testing we do, we actually transfer our training zones over to your systems so that you can get accurate, you can be able to train accurately the right intensity every time. The best way to be able to determine zones is through metabolic analysis. But as I teach, you need more than one metric to be able to determine changes in intensity zones themselves. So that's why I combine multiple things like metabolic analysis and near-infrared spectroscopy to be able to accurately determine when your system changes from one type of fuel to another, which is the goal of intensity zones. With metabolic analysis, you have to look at the trends, look at multiple factors, and then you're going to be able to identify accurate changes in fuel source and therefore be able to set zones accurately. One of the most important parts of your training is the intensity at which you train. It has the strongest effect on determining what system responds to that stress. So whether you're working in zone 2 or kind of a more continuous low to medium intensity work, that has the strongest effect on the metabolic systems and can have a profound effect on your VO2 max as well. So we know that training at different intensities is extremely important. And if we can identify through testing where your biggest limitations are, and we can determine your zones, then we therefore can prescribe the most accurate training program to be able to affect the changes that we want at the system that we wish to have the most profound effect over time. I think physiological testing is the most important thing for medical clients. I've had the joy of working with multiple medical clients over 25 years, even being able to use physiological testing to be able to determine that they had a medical problem in the first place. Whether it was cardiovascular, respiratory, or metabolic, I managed to find these limitations long before anybody was diagnosed with a medical condition. But once you've been diagnosed with a medical condition, you need to understand that your physiology has changed somewhat. And therefore, you can't apply the general ideas on nutrition and exercise with this population. What I like about doing physiological testing with a medical population is it sets my baselines. It allows me to be able to direct their nutrition and training recommendations specifically to how they performed on the day. And that way I'm not just making suggestions based upon this is the best thing to do with somebody who has diabetes, whereas I can be able to determine that we need to be more aggressive in this direction on this particular case, and perhaps less so in this direction with that case. So, for example, if you got somebody who you think that resistance training would be helpful, but actually they have a fast metabolic rate and their body composition has high lean muscle mass, you're going to waste their time in the gym doing resistance training, where you can focus them more on their nutrition and their other exercise components to maximize the results to improve their health and their medical condition. So near-infrared spectroscopy, or NIRS, I've been using for over 15 years, and it was one of the best things I've added to my testing. So it's a device that uses light to be able to measure the percentage of oxygen on the hemoglobin. So in other words, the oxygen being delivered to the cell, and therefore the oxygen that's also been used at the cell. The device is only about this big, and it can be attached to any muscle that we're testing. In the case of doing exercise that runners or cyclists, a lot of cases we put it on the quad, and it actually directly measures the percentage of hemoglobin loaded with oxygen. If you've ever been to the hospital and they put something on your finger, that's a pulse oximeter that measures your systemic hemoglobin and oxygen percentage. The NIRS device actually measures specifically at the muscle where it's attached. And that kind of information provides me with an idea of how's your respiratory system and your cardiovascular system or blood at delivering oxygen to the cell, and how well is the cell at being able to use that oxygen and be able to take it off of the hemoglobin and be able to use it at the muscle, or your metabolic health. You combine that with metabolic analysis, measuring O2 and CO2, and a direct measure at the cell, at the muscle. Absolutely amazing combination. And near-infrared spectroscopy is a very important part of my testing methods. So near-infrared spectroscopy works for me to be able to look at the balance between oxygen delivery and oxygen utilization. So if you look at oxygen delivery, obviously that involves the lungs, but not just the lungs, but the blood. Because of course the oxygen needs to be able to bond to the hemoglobin in the blood to be able and make it through the vessels to be delivered to the muscle. So that's the oxygen delivery side of the house. Utilization is at the muscle cell itself, and we can look at the percentage of oxygen that's being taken off of the hemoglobin at the cell to be able to get an idea of the health of the cell or the cellular metabolism itself. This is extremely important because we can determine, for example, if we're measuring at the muscle and we determine that the percentage of oxygen being delivered on the hemoglobin is extremely low, we know we have a delivery issue. If we look at it being high but declining, so sitting maybe about 80% and only declines to about 60%, your body's leaving 60% of the oxygen on the hemoglobin. So that's a utilization problem. What we're looking for is a high percentage being delivered and your ability to use that percentage over time, even down to as low as I've seen down to 3 or 4%, because the cell is using the oxygen so well that it's ripping it off the hemoglobin in order to create energy. So extremely important device, and this is the information it gives me. Oxygen balance between oxygen delivery and oxygen utilization. Spirometry has been around for a very long time, and I started doing spirometry and teaching spirometry to other people that I've taught physiological testing around the world as being extremely important. With metabolic analysis, we can measure the volume you're breathing per breath and the frequencies, but how do we correlate that to you? So by doing spirometry, which is a small device that measures your lung capacity, and we can test it before we actually do a full physiological test, I can determine the size of your lungs or your lung capacity, and I can look at how well you can move oxygen by doing what we refer to as a FEV1, or the forced expiratory volume 1 second. So what we do is we make you do a test using a spirometer, and the spirometer can measure your lung volumes using a forced vital capacity, or an FVC test, which allows you to be able to breathe out fully, breathe in fully, breathe out forcefully as hard as you can, and breathe in again as deeply as you can. So this combination of this movement measured by an extremely accurate device, I can determine the size of your lungs, the functional capacity of your lungs, as well as how quickly you can move that air. From that, I can determine whether you have a limitation in comparison to others, your age, gender, height, and even ethnicity, using a set of norms that are available across the world. So I can determine whether you have a respiratory limitation there. I can also use those numbers to compare against your results during the active test. So your VO2 Max test, we can look at the volumes you can move, and we look at your frequencies, and we compare the two to be able to determine how well you can use the capacity that you have. So spirometry measures your lung capacity as well as your ability to use that lung capacity when you're forcefully expiring. So how it identifies limitations is I can look at a set of norms by age, gender, and height, and even ethnicity, and compare your results to a huge set of norms. So right off the bat, I can have a clear idea of how you compare with others. And then I take my active test and I can compare it against your performance on the spirometry. Now, what could we find for limitations? We can find that you have a capacity limitation where your lung capacity is lower than normal. I can determine that despite the fact that you have normal lung capacity, you can't breathe out powerfully. In other words, you can't use your lung capacity quickly, which of course is required when you're active. By using metabolic analysis, I can determine your ability to use that capacity that you have. So I can determine that you have, for example, a medical condition by doing the spirometry, which I would put in as a capacity issue, or that you have perhaps a restriction to your thoracic spine and ribs and their ability to be able to move, or you lack expiratory power. All of these can actually be trained, and that's extremely important. Everything that we find, we can train. So you can look at, on that's more the health side. On the performance side, if I find, for example, that you have normal lung capacity, but you can't use it during your active test, we can then improve your performance by doing some coordination work that will actually improve your ability to use your capacity when you're moving. And that's quite common, especially in the elite athletes. Anybody who has, for example, a history of low back pain will usually have decreased capacity or the decreased ability to use their capacity during exercise. So it gives me tons of information to determine what type of health or performance limitation the person has related to respiratory, and I can train each of those limitations differently. All right, so body composition testing, I'm sure you've seen these devices around, you've seen them online selling them, where it actually uses electrical impedance to be able to measure what percentage of fat that you have within your body and also the percentage of lean muscle mass that you have. It will do a algorithmic calculation of your resting metabolic or basal metabolic rate. Some are accurate, majority are not. It is important information. I consider it the fourth most important piece of gear that I use, behind metabolic analysis, near-infrared spectroscopy, and spirometry. Nice to have to be able to look at measurements over time. In other words, if I am trying to work with a weight loss client and the first thing I need to do is build lean muscle mass to improve their metabolic rate, they may not lose weight, but they may change the percentage of lean muscle mass they have in relation to the fat that they have. And allows me to be able to get them ready for that to be our goal first. So I find it really good as a retest. It does help for me to make some decisions on the importance of resistance training. So if the person's overweight, but they have good lean muscle mass and their metabolic rate is high, I don't prioritize resistance training as much as I do with somebody who has the contrary results. So body composition, somewhat important. In a lot of cases, it just adds another metric to be able to compare with several other metrics that I have, which I always do. I have a minimum of 2 metrics that I use to make decisions, and I think that's really important. I use body composition in combination with results of a resting metabolic rate test using metabolic analysis. So the two of them together, for example, if you have a slow resting metabolic rate, and you're not burning as many calories as you should at rest in comparison to others your age, gender, and height, I can use that in combination with body composition to look to see if you have a lower lean muscle mass, because they usually correlate well. In other words, a slow metabolic rate is usually related in some ways specifically to low lean muscle mass. Therefore, my prioritization of resistance training would go up. Whereas if somebody, for example, were still overweight or obese, and they had good lean muscle mass and the resting metabolic rate was normal to high, I would prioritize other types of training to be able to have the success to help them with their weight loss. I need direct measures of the three systems that I need to be able to determine what your priority is. So I need something that measures cardiovascular health. I need something that measures respiratory health and something that measures metabolic health. I have selected spirometry, metabolic analyzers, and near-infrared spectroscopy because that's the right combination for me to be able to look at and analyze each system and determine which of these are a major limiter to the person's either medical condition, health, longevity, function, or performance. And I'm very happy to say, using these three devices that I use, I can clearly identify your limitation of performance. I can clearly identify your zones. I can clearly give you prioritized training and nutrition guidelines, and you will achieve your goal. I would highly recommend absolute physiotherapy. The reason why is you've got someone who has over 25 years of experience in physiological testing, has taught internationally. More than 2,000 people completed my course on physiological testing internationally. I have taught it in China. I still have international consultations through the United States, Canada, all across Europe, as well as in South America. You can't analyze the information accurately, which is the most important part, without experience. And I have analyzed thousands and thousands of tests over my lifetime, and I've actually developed my own analysis system to be able to identify limitations, set zones, and be able to prioritize training and nutrition recommendations. So get tested here. We have the right equipment, multiple devices to be able to cross-correlate information, to be able to give you accurate ideas of what your intensity zones and limitations are, and the experience behind it to be able to prescribe the best exercise and nutrition and respiratory training recommendations out there.